So I wanted to just give hopefully a fairly short discussion on apraxia. Um, so apraxia, there's different types of apraxia, and it is something specific to being unable to perform task or movement when asked. Even though the request or command is often understood, the patient is more than willing to do the task. There is not a deficit in strength, and this task may have been already learned, but it's just the inability to perform that task. So it's not the strength issue. Is it coordination issue? In some cases, yes, but it's more of just the difficulty of executing a specific task. Often related to an injury. Well, it is related to an injury to the brain from a stroke or a TBI, or it could be another problem of the central nervous system. I thought this video was quite good. It's about ideomotor apraxia. We'll take a look at it together for just a moment. So this young lady, so you can see she's really struggling with this task. And so the person acting the role of therapist, you may think, well, that's really cruel making her coordinate with her right hand, because, I don't think I can do that if I was using my non-dominant hand. Well, I bet you actually could. She is an example of someone with apraxia. I don't know how it would go if she used her left hand. I don't know that. And then closer in the middle, she has another episode where she's struggling to complete a couple of tasks that she's been asked to do. So in this case, she just does not know how to use her hand in a way to signal stopping. You may ask, well, maybe she just doesn't know how to do the task. Well, she's not able to put her hand in the way to execute the task she's being asked to do. And it's just something she struggles with. And it's something that, from just the interview, it shows that she has struggled with before, and they've been working on it. I want to move ahead to the video on specifically the French-speaking therapist working with the obviously French-speaking patient. Don't get hung up on the language. Sometimes students will say, well, Mark, it was difficult to watch it because they were speaking French. Well, just mute it then. I'm not fluent in French. I know some basics. And that's not the point of this, is to learn French, is to watch how a therapist is progressing a patient who is pushing himself away to start with, using his dominant side, not his weak side, his intact side, which is his right, and pushing himself towards the left. And I think this is somewhat the phenomena, Pusher syndrome, and they're working at re-education. So I'm just going to put the volume down for a minute and just kind of watch. See, he's not being allowed to use his hand, and so he's just tilted over to his left side. He has a difficulty with vertical and horizontal in terms of therapist is using this firm mattress table to really get the guy a sense of what is symmetry and midline. And I think he does just a beautiful job. He initially has the guy on his left side, which is his weaker side, and then he allows him to use his right side later once he has the patient being more, using his left side more for stability. So now the patient has the right hand in that pusher's position. So now he's asking him to remove his hand. He says, I'm standing by to watch you as you take away your hand. And what I want you to do is keep midline, keep oriented, and then he's going to progress the guy to put the hand on his lap, which is a progression. And you say, nope, you're going too far to the left. Let's get back to the right a little bit. Let's get back to the middle. He's not yanking on the guy's neck, so I don't think he's abusing this gentleman. He obviously has skill. He's using his hands appropriately. We know that you need to orient the upper body and the head in order to get somebody back to midline. Without orienting the head, you just aren't going to have any success, and that's true in many of your neurodevelopmental techniques. But look how much better the guy's sitting. This is really cool. And using that left hand to do some weight bearing, you can see, versus just holding it in that more typical stroke position, which is internally rotated with some hand pronation as well. And now the narrator, the therapist, is narrating and talking while this other therapist is working with the gentleman. And I think it's the same gentleman. What the therapist is going to have him do now is he's cradling the arm, which is what he was doing earlier, and with less cueing, he's now able to bring himself upright versus being forward and shifted to the right. And now he's kind of shifting too much to the left, and she's using that little bit of a cue on the head and neck. Voila! I mean, it's very good, perfect, I don't know about perfect, but voila, let's do this. Here we are. Here we are. I love the romantic languages. They say so much in just a few words. Now he's shifting his trunk. He's moving in a rotational component, which is just beautiful to see. And now towards the end, he is doing an activity related to daily living and going manipulated objects vertical and horizontal. It's just a beautiful thing. So I hope you enjoy the video as much as me. Again, knowing French is not the object here. I know it's a little hard to see, but it's probably one of the better videos I've seen on a true progression of a patient from a more severe Pusher syndrome to actually getting back to some using or performing some activities of daily living without pushing themselves towards the opposite direction with the dominant side.